Welcome to week 38, Mama. The final countdown is on as you await meeting your baby. I went into labor with my first at 38 weeks, but didn't go into labor till 40 weeks with my second. Every baby and pregnancy is different, and allowing your baby to lead the way for when labor starts is one of the best things that you can do for your baby at this point in your pregnancy. Before we dive into what's going on at week 38, if you're new to these week-by-week updates, I'm Bridget Tyler. I'm a Lamaze childbirth educator and birth doula, as well as a mama, and I'm just so glad you're here. As you're wrapping up your pregnancy, preparing for birth and postpartum, make sure that you've subscribed to this channel and you've hit the bell so you're notified each time a new video about birth or postpartum comes your way. So at 38 weeks, your baby is about the size of a loaf of bread. Some babies weigh around 6 pounds, while others are estimated to weigh around 8 or 9 pounds or more. These weight checks are usually estimated using a third trimester ultrasound. Third trimester ultrasounds are common if you are birthing in a hospital setting, but they're not always beneficial. In fact, a study done in the Netherlands, which by the way has better pregnancy care and outcomes compared to most of the world, especially the United States, so we should definitely be paying attention to what they're doing, found that third trimester ultrasounds, while they did detect more small for gestational age babies, they did not reduce the incidence of severe adverse perinatal outcomes compared with usual care, and concluded that for women with low-risk pregnancies, the findings do not support the use of third trimester ultrasounds. So there's some evidence for you, and that's linked down below for you to check out yourself. But let me also share my personal experience with you, which is totally anecdotal. Women who receive routine third trimester ultrasounds are more likely to be diagnosed with an assumed big baby, assumed small baby, too much amniotic fluid, or too low amniotic fluid. And again, in my experience, end up being induced or waiting for birth and have totally healthy, normal weighing babies that did not need to be induced or stressed over in those final weeks of pregnancy. So there's that information out there for you. I don't recommend going off anecdotal advice, which is why I've also provided you that study from the Netherlands. But if you are a healthy woman who has had no pregnancy complications, I would highly encourage you to think about whether the third trimester ultrasound is right for you. Also, I have a video talking about presumed big babies, which is linked right up here in the corner of this video. At this point in your pregnancy, your baby might drop further into your pelvis, and this can be a very welcomed experience as it frees up space to eat a little bit more, breathe a little bit easier, and move a little bit more comfortably. Some moms stress about their baby not dropping into or engaging in their pelvis. Don't be that mama. There's no need to stress. Many babies, especially to first-time moms, don't drop into the pelvis until labor starts, and contractions are helping them move into the pelvis. If you want to start doing some exercises to help prepare your baby to engage in the pelvis though, there's nothing wrong with that, and I have a video for that linked down below in the description. That's it for this week's update, Mama. I'll see you next week in your 39 weeks of pregnancy. Bye for now.